One question that I'm often being asked at the clinic is, how does it feel like when baby turns head down?
Yeah, so we decided to record this video for you in which we first gonna explain the symptoms of baby turning head down that you would feel the very moment when your baby turns. And then afterwards, we are also gonna discuss the symptoms of baby turning head down after your baby has turned.
Yeah, and finally we are also going to explain what you need to do if you want to check yourself if baby is head down. I am Natalie, a pregnancy and birth consultant and TCM therapist.
And I am Matthias, a researcher and science geek, and we love helping mummies and their babies naturally and science-based.
For more useful tips and tools on pregnancy and baby related topics, subscribe to our channel and hit the bell so you don't miss any of our videos.
Okay, so first of all, please note that most babies turn at night while their mother is asleep. Therefore, most mummies are not gonna feel that their baby turns. Moreover, about 75% of all babies turn before week 28 and about 90% of all babies turn before week 32. What this means is that most babies are still very little when they turn. So chances are that you're not gonna feel it at all.
Right. However, the later in your pregnancy your baby turns, the more likely you're going to feel it. If that's the case for you, you would most likely feel the following kind of symptoms. First of all, the moment when your baby turns head down feels like your whole belly is moving. Women who have experienced that moment report that that feeling is very different from the usual kicks or movements. While usually you would feel those kicks and movements in some areas of your belly only,
Right.
but when your baby is turning, it feels more like those kicks and movements are everywhere in your
Yes.
belly.
Nevertheless, it could be that some of those kicks are particularly intense in some areas of your belly. For example, a mother that we personally know described it as sudden and very intense pressure on her stomach. So as your baby turns, baby may kick against some of your organs. Also, that pressure on her stomach made her feel really nauseous, as she told us. In fact, nausea after a period of increased activity of your baby is our second symptom of baby turning head down. For some women, that feeling of nausea can be pretty intense. Others simply describe it as that strange feeling in your stomach that you might feel right after you spend some time on a roller coaster. So I guess it really depends on what your baby kicks against as your baby turns.
Exactly. Now, no matter if you are aware of the very moment when your baby turns or not, the things that you're going to feel after your baby has turned are going to be very different than before.
Yeah.
So let us quickly walk you through the symptoms and other things that you would feel once your baby has turned head down. And please keep in mind that you are more likely going to feel these things the further you have progressed through your pregnancy, because then your baby will be obviously much bigger, okay?
That's right. So the first symptom of baby turning head down is obviously feeling your baby's head lower down. And this is something that you can actually feel by palpating your belly. However, it's not an easy task. Keep in mind, only a professional like a midwife can really tell you the exact position of your baby. So what we are about to show you is really just to give you a rough idea about your baby's position, okay? So basically, the main problem that mummies usually have is that they find it hard to distinguish their baby's head from baby's back or bum when they palpate their belly. However, under normal circumstances, when your baby is head down, you would feel a lump either on the left or the right side of your belly, depending on your baby's position. And that's your baby's back.
Yes. So the best thing that you can do is try to find your baby's back first by palpating your belly while you lay on your back. Or simply tell someone to help you with that.
Right. However, please keep in mind that under certain circumstances, like for example, when your baby is lying back to back or in a transverse breech position, then it is going to be particularly difficult to feel your baby's back, okay? So it really depends on your baby's position in your belly.
Right, so again, we are looking for that lump either on the left or the right side of your belly. If your baby is turning head down, then that lump would be your baby's back. Now, once you have found your baby's back, you can then move along your baby's back into both directions and see what you're feeling. The baby's bottom feels much softer than the head and not so distinct. So try to palpate the top of your uterus and see how it feels like. The head, on the other hand, feels much harder. And so obviously, if your baby has turned head down, you would feel the harder end, if you will, lower down.
Yeah, so ideally you ask someone to try to carefully palpate your baby's head with their whole hand like that. And this can be done when you lay on your back. If they can feel the harder end in the area of your pelvis as opposed to the softer end being at the top, then it is likely that your baby has turned. But again, it's not an easy task.
Yes, just tell that person that that little thing in your belly is a precious living baby. So they better be gentle with that little cute head.
Yeah, like I was, for example, my hands basically formed that little cute head of our son.
It was all my body, it formed it to
Okay,
perfection.
was your body fine? Anyways, if you're liking this video so far, we would be super grateful if you could leave us a comment in the comment section below. Or simply subscribe to our channel and or like this video so that we know that you found it helpful. Any feedback is more than appreciated. Thanks so much. Okay, so with your baby's head in your pelvis, you are going to feel more pressure on your bladder, which is our next symptom of baby turning head down.
Yes, from the moment when our son turned, I suddenly had the urge to go to the toilet more often. However, it was not as bad as when he finally dropped, okay? There is still a huge difference.
Huge difference.
When our son dropped, I basically went to the toilet every 10 minutes.
Every 10 minutes you basically lived on the toilet. I even brought a cupcake so she didn't need to starve on the toilet.
You mean that our son didn't need to starve?
Well, that too.
Anyways, so the pressure on my bladder definitely felt different for me once he turned head down.
Yes, in general, you're going to feel more discomfort in the lower part of your belly after your baby has turned, which is our next symptom of baby turning head down. For the most part, that's because your baby puts more pressure on your pelvis, and that pressure too will increase considerably as your baby drops, i.e. engages in your pelvis.
Yeah. On the other hand, you're going to feel less pressure in your upper belly, which is our next symptom of baby turning head down. As a result, you would feel less pressure on your stomach, and it would feel as if you have more room to breathe.
Yes, and that is of course because now your baby's head is no longer putting pressure on your upper belly. And then one thing that would also feel different than before are your baby's kicks. So the next symptom of baby turning head down is a change of the position of your baby's kicks.
Yes, so obviously with your baby's head down, you're going to feel kicks in your upper belly and no longer in your lower belly. However, please keep in mind that it depends a little bit on your baby's position. If your baby's back is more towards the front of your tummy, then you're more likely going to feel the kicks under your ribs. However, if your baby lies with baby's back against your own back, you're more likely going to feel the kicks at the front of your tummy.
Yeah, but it's not only the kicks, it is also the movements of baby's legs and arms in general that suddenly change. So our next symptom of baby turning head down is a change of the position of the movements that you're feeling. In other words, once your baby has turned head down, you would feel the large movements, which are the movements of your baby's legs, higher up. Conversely, you would feel the small movements, i.e. the movements of your baby's arms, further down.
Yeah, and then finally, something that I personally felt very clearly was that the location of the hiccups changed. This is our final symptom of baby turning head down. The hiccups of your baby are probably something that you're very familiar with. However, if your baby has turned head down, you're going to feel the hiccups in the lower part of your belly. Again, I could feel that change very clearly. So maybe this applies to you too.
Yeah. Now, as already mentioned, figuring out yourself if your baby has turned head down is a very difficult task to accomplish. A more reliable way is certainly having a midwife determine your baby's position. However, the goal of this video was to help you understand what you're going to feel when and after your baby has turned and how it would feel different than before. So we hope that we could give you at least a rough idea about the position of your baby in your belly.
Yeah. Thanks so much for watching, and please remember to leave us a feedback in the comment section below, or simply like and share our video if you have found it helpful. Any feedback is more than appreciated.
Yeah, and for more useful tips and tools on pregnancy and baby related topics, make sure to subscribe to our channel and to hit the bell.